And now we shift to Rebecca Katz, Director of the Center for Global Health Science and Security at the Georgetown University. Please, Rebecca.
All right, thank you. There we go. On November 8th, 2016, I was part of a US delegation involved in a 3-week arms control negotiation. And during our morning delegation meeting with the ambassador and the undersecretary of state, the US presidential election was called for Donald Trump. I say that some members of our delegation broke into tears, others cheered, and regardless of how we felt, we were instructed to say the following. We live in a transparent democracy. The will of the American people has spoken, and we do not anticipate our negotiating position changing during the next 2 weeks. So this was a phrase that I ended up repeating many times in the course of a day to delegations around the world. And I've thought a lot about that, particularly recently, and particularly in relation to pandemic preparedness. So what does it actually mean to live in a transparent democracy, and what happens when the will of the American people speaks, and it's not necessarily what you personally want it to say, and when it, in particular, supports actions that inherently make us less safe? So America is still a democracy, and our state of pandemic and epidemic preparedness is not okay. We've spent the better part of 20 years working to produce scholarship on how to strengthen pandemic preparedness with a focus on governance and policy, but also looking at financing and evidence to support decision-making and what is required to effectively respond to public health emergencies. And I am more than happy to talk about all of that and any of this work and some of the data that we've curated for over a decade, including efforts related to policy epidemiology for emerging infectious diseases. But what I wanted to focus my few minutes on here today is how, despite our resources and knowledge and past interest in outbreaks and pandemics, the stated domestic capacity to respond to infectious disease threats in the United States is significantly challenged right now. So, post-pandemic, the state of public health in the US can be captured in a series of statistics. So this slide said that there's 62 beds in the country for viral hemorrhagic patients. There's actually really only 55 that are operational, and there's not a great system in place for patient movement between those sites. Approximately 65% of local health departments in the United States do not have an epidemiologist on staff. There is no infectious disease doctor in over 80% of counties in the United States. In over 1,100 counties, there is no birthing facility, and that impacts approximately 2.3 million women of reproductive age. 1 in 5 local health departments reported job loss in 2023, and almost all are facing additional cuts this year, some of them very significant cuts. There's been a rollback of vaccine requirements. There's been exciting news in some of our states, including Florida and Idaho. State legislatures are changing local law to criminalize mask wearing. They're stripping executive governors of emergency powers. And there are some states that are banning any government entity from issuing vaccine mandates, particularly for COVID. So, all of this is important because public health powers in the US sit mostly at the state level, although there is certainly a complex web of law and policy for responding to public health emergencies. Approximately 80 to 90% of funding to state and local programs that monitor and combat infectious diseases comes from CDC grants, or did. In some of the work that we've done for the National Disaster Medical System, we've found over 570 different laws and regulations relevant for responding to public health emergencies just at the federal level, and even more at the state and local. There's over 1,400 in just 12 states. And a joint external evaluation that was conducted in the United States in fall of 2024 identified some, but certainly not all, of the flaws in the US, and focused on issues that I'm sure we are going to come back to around trust, equity, and solidarity. But then we had the election that brought Donald Trump back to power. And you are all no doubt very familiar with the decisions that have been made impacting global public health, including the announcement of the planned withdrawal from the WHO, the rejection of the IHR amendments, the closure of USAID, and the cessation of billions in multilateral and bilateral aid. Domestically, we are seeing similar dismantling of public health and healthcare activities, including the reduction in force of many in the federal government, particularly in Health and Human Services, and $11.4 billion in planned cuts to state and local health departments. And cuts in federal funding, including Medicaid, our ability to ensure our low-income population, means that approximately 10 million people are going to lose access to care. Over 700 rural hospitals are at risk of closure, and it's getting harder to receive primary care outside of major cities. Additionally, these cuts are directly impacting state revenue, which is leading to the closure of public health laboratories, reducing diagnostic capacity and time to detection of outbreaks. Also, we've heard about how wonderful mRNA vaccines are, but we've seen a $500 million cut in federal funding for vaccine research in mRNA. The CDC, which states and locals look to for surveillance, outbreak support, and everything in between, has taken massive hits to its staff, and the Trump administration proposes to cut even more of the institution. And the numbers keep changing, but this is a sense of the parts of CDC that are expected to be reduced. Leadership at CDC has either been fired or forced to quit, and it's unclear how many more staff will be let go. And as Beth knows well, there is nobody left at the White House working on pandemic preparedness and response. So this has meant that when there was a lead poisoning outbreak in a state, and the state called for assistance, CDC, which had just let go of its entire lead poisoning team of experts, had to say no. This has meant that when there was a measles outbreak in Texas, and the state and locals not only did not receive sufficient support from CDC, but the federal government, under RFK Jr.'s guidance and leadership, tried to push vitamin A instead of vaccines, leading to vitamin A challenges with some of the children. This has meant that it took weeks for the federal government to send a health alert notice to clinicians on the Ebola outbreak in the DRC that Dr. Fauci talked about in September. The government shutdown, which I'm pleased to announce has apparently just ended, basically stopped all disease surveillance activities, not to mention challenging the 42 million Americans who receive SNAP benefits for food insecurity. So I actually live across the street from the NIH Clinical Center that Dr. Fauci treated patients in. But 3.5-hour drive due west, I have a home in West Virginia, rural West Virginia. I love it. It's beautiful. I bake, I hike. It's better than blood pressure medication. There's almost 28,000 people in the county, in Randolph County. And of the 11,000 people who voted in the presidential election in 2024, 72% voted for Trump. From my house on the top of a mountain, it takes, in good weather, in my 4-wheel drive truck, 45 minutes with 0 cell phone reception for that entire period of time to get to the nearest emergency care facility. This facility, the Grant Memorial Hospital, it became part of the West Virginia University medical system approximately 2 years ago in order to try to keep it from closing. Now, across West Virginia, where the foreign-born population in the state is less than 2%, 1 in 3 doctors are foreign-born. The state is facing a projected 14% shortage of physicians and currently has a 19% shortage in nurses. And there is a current proposal for a $100,000 per year cost for H-1B visas, which will destroy the already limited access to care. So it's not all doom and gloom. There's a lot of doom and gloom, but it's not all. States are actually coming together to form some new public health alliances to try to counter some of the federal actions, to try to improve surveillance, to try to reestablish trusted guidance and have some purchasing power for medical countermeasures. Some of the cities are doing the same, particularly around vaccination efforts. Civil society is mobilizing and engaging, and they're sending newsletters with surveillance data. Academics are trying to fill gaps and serve as intermediaries with international organizations and healthcare entities. And given the state of things, this is leading to some new thinking, conceptualization around how the private sector can better engage in health security efforts. Some of our own work is focused on supporting private sector entities and strengthening surveillance and response efforts, not only as part of their business model, but also in support of public systems. So, what comes next in a transparent democracy, where the American people express their will every election cycle? I'm not sure. I'm not sure, right? And I think there's a lot of us who really don't exactly know what happens next. Is there a narrative that accurately describes pandemic preparedness to the American people? What are the consequences if we're actually not prepared? As many of you have probably seen, there is a America First global health strategy. Will it stay that policy? There was some leaked documents last week showing efforts to implement that policy in contracts and negotiations with bilateral partners, which may impact global governance, particularly around access and benefit sharing. There are questions around, there will be a lot of discussion of trust, but whose responsibility is it to rebuild trust in science and facts? And what does this future of public-private integration and innovation look like? And I think, I'm quite hopeful that the American people will become maybe more aware of what public health actually does for them, why who they vote for impacts access to care and food and governance of pandemics, and hopefully we will establish a better relationship between the public and public health activities. But there's a lot of time will tell, and we shall see, kind of repeated as almost daily mantras. So with that, I will finish. Thank you.